Larner College of Medicine. It has made a huge commitment to ensuring that all their students are learning in the most active way possible. There's great evidence that this helps students learn more and learn to apply better in clinical settings.
The big change with the branch campus will be the living environment, because the students will be coming and staying and living in Western Connecticut for 2 years.
We have 7 core clerkship rotations. It starts from peds, then OBGYN, then surgery, then internal medicine, then neurology and outpatient internal medicine, and then psychiatry, and then family med. So it's really the core medical specialties, and you go through it. It's 6 weeks at a time.
They get a flavor of all of the different types of medical practices and helps them start to understand not only the foundations of clinical care, but what they may want to specialize in.
So there's a lot of advantages to doing all my rotations in one location, either Danbury or Norwalk Hospital. You get to get comfortable with the hospital and learn the EMR really well. So when you start rotation, you can start at full speed right away. You can feel more confident knowing where everything is.
The diversity of cases is essential to the training of a good doctor. You have to see a lot of patients. You have 2 hospitals that serve a population over 600,000, 2 very active emergency rooms, and there's a nice balance of primary care and specialty care. So over the course of the 2 years students are with us, they're going to see everything from the simplest outpatient cases to the most complex inpatient cases.
I absolutely feel like an active participant in patient care here. A lot of the rotations don't have residents, so you're really the first person up when they need help. They're looking to someone to be there for assistance.
One of the biggest reasons I decided to come to UVM was because during their interview they really got across to me that they're committed to diversity and health equity, both of which are issues that are really important to me and something that I want to take part of when I'm a physician.
You get exposed to almost every language that you can imagine. You really get very practiced in using translators to speak with patients. You learn about cultures and how that's affecting their health and how you need to communicate with patients in order to achieve what your goal is and what their goals may be.
We've had a global health program here for several years and a strong partnership with the University of Vermont in that global health program. For those students who end up studying here on this campus, during their 3rd year, they will learn more about global health in general and specifics about the country that they've committed to. And then in their 4th year, they will return to that country and actually participate in patient care. And they will take a first-year student under their wing.
When I am in Uganda or I am in underserved community, I remember why I chose medicine, why I want to be a doctor.
We have an incredible cultural diversity going from Russia to Africa to Latin America and Vietnam, as well as different styles of hospital, different styles of approach to care that really broadens the opportunities for our students.
One of the wonderful things that this program does is that it brings over scholars from the countries with whom we work. These people bring to us their experiences.
A whole element of medical education in general is, dealing with situations that are very uncomfortable for you, and finding a way to deal with those situations in a foreign country only lends itself to better education.
There are a lot of reasons why I decided to come to the Connecticut campus. One of the biggest factors and one of the things that drew me to UVM was the fact that they would have the Connecticut campus because I'm from around here and I like the area.
So I really like the area here. It's densely populated. There's a lot of fun things to do. You can go to South Norwalk in 5 minutes and find a variety of restaurants from all over the world, any kind of food you want.
We also have proximity to water. There's a lot of outdoor activities, biking, skiing, things like that, all in reach.
I've spent a lot of time in the city, which has been a lot of fun. Boston is close as well. I've been really pleased with life outside of the hospital.
Students will encounter a lot of very committed mentors here. All the clerkships are populated with clerkship directors who have several years of experience educating medical students and with a keen understanding of the curriculum from the University of Vermont.
The faculty is a very engaging faculty that are really considered the leaders of their field.
There are doctors here that are top of their field and that are very willing to teach us and teach the residents and just make our experience here great.
I think the student that would thrive here is somebody who's really open to really just whatever comes, learning from each and every patient, getting that diversity, understanding different people.
As a medical student, it's great to be exposed to people who come from different places, different backgrounds. You're learning every day something new, so it's important to make you a better doctor.